Hello and welcome to hashtag Our Doc Talk. This is NorthBay Healthcare's effort to reach out to our community and connect you with some of our physicians answering important health questions. With me today is Dr. Angela Lim. She is a specialist in osteopathic manipulative medicine. She's a graduate, got her medical degree from Michigan State University College of Osteopathic Medicine, and is board certified in neuromusculoskeletal medicine. My theory is the more letters in your title, the longer you were in school. So, thank you for doing this, and we're just going to hop right into it because we have a lot of questions that people have already posted for us. So let's start out first by just explaining what is OMM.
Well, OMM is basically a way of diagnosing and treating the body using the hands. And this is something that we're taught from the first day of osteopathic medical school.
How is osteopathic degree different from like a medical degree?
Well, your doctors that you're used to seeing typically have MD behind their names, but
Right.
You'll notice that some of them have DO behind their name. We all went to medical school. Actually, at Michigan State, I went to the same classes the first 2 years with my MD counterparts. But in addition, our osteopathic medicine, our schools teach this hands-on right from the start, separate from the MD students.
Wonderful. Thank
Yeah.
you.
Mm-hmm.
So how does osteopathic manipulative medicine work? I mean, what's involved in a typical visit?
A lot of it is getting to know you as a patient, believe it or not. It's this new fad I read about with lifestyle medicine. Well, osteopathic medicine, we've been doing that for a long time. I evaluate what your diet is like, what you do for exercise, if any. So we get into all of that in history and trauma history, if you've gotten into any falls, car accidents, things like that, that could affect your body. And then we get into an exam. We look at your nerves, we look at your reflexes, we look at strength, we look at your body as a whole, how things are lined up, if things are moving properly. We look at all of it. So that's typically a 45-minute initial evaluation. And then each time you come back, I reevaluate from head to toe and kind of see how the body changes from one visit to the next, and then kind of assess what needs to be done next.
Okay. And just a reminder to those of you who are watching on Facebook, if you have a question, you just, like any other post on Facebook, you click comment and type it in. We'll be able to see it and ask the doctor, and she'll answer it live right here. How often did you get to talk to the doctor for free? What are some of the common conditions that you use OMM to treat?
Very commonly, we see a lot of pain. We see a lot of chronic low back pain, neck pain, headaches, shoulder pain, hip pain, also some sports injuries. Not as commonly, but we do see those as well. But it can be used for a lot of other things.
Okay.
Yeah.
So I had somebody ask on the previous post we did to promote this, to talk about is this good for things like fibromyalgia or arthritis?
Yes.
In those kind of conditions.
Absolutely.
So anything does it have to be muscular, skeletal?
No. OMM can be used for many different things, and in fact, OMM can be used inpatient as well. We don't have an inpatient service currently, but in my training, we went into the hospital. We treated newborn babies that had breastfeeding issues. We treated people in ICU that may not be responding well to their antibiotics. People with pneumonia and respiratory issues. We can work on optimizing the body's movements with respiration to help with respiratory issues. We also work with post-op patients to decrease their usage of pain medications and to improve GI function so that hopefully they'll move those bowels, have some flatus or move gas, if you don't know what flatus is, so that they can get home quicker so that they're not in the hospital so long.
So is it safe to say that the osteopathic approach is like whole body?
Absolutely.
Okay.
Yes.
So and that means it can be applied to any part of the body, correct? Okay.
Yep.
How is OMM different from, say, chiropractic or massage therapy?
There is some overlap because we use our hands, but our education is much more extensive. Like I said earlier in the talk, but in case you missed it, we are trained right alongside MD students. We learn everything from pharmacology to biochemistry to physiology, of course anatomy. We learn everything through and through and rotate through the same rotations as your MD students. We are residents alongside your MD counterparts, and we do everything in medicine. You'll find DOs that are surgeons, you'll find DOs that were Surgeon General and team physicians for pro sports teams. So that's where we have an advantage, because when you go see your osteopath, you're seeing a full-fledged physician that has all that training. Chiropractors, they're very well trained in musculoskeletal stuff. They can crack you, they can pop you. That's where they start, but they don't have the medical background like we do. There are some very good chiropractors out there that crack and pop and do their techniques, and that's what they get in chiropractic school. But most of them have to get additional training in the other techniques that we're taught in osteopathic school. A lot of the soft tissue techniques, myofascial techniques, things that don't crack and pop, chiropractors usually have to seek out additional training for those things. I can't speak exactly for every single school of theirs. I can only speak on my own training. I know some very good chiropractors, and I know some that may not be a great idea to go see them, but that's neither here nor there. Massage therapists, again, they go through their own specific training. They work mostly, and I think they're legally only allowed to work with soft tissue because that's in their scope of training. So you almost have it on the other side where they do mostly myofascial work and soft tissue work, but they can't crack and pop, and they don't have a medical background. So that's the major difference, is the educational background.
Okay. So how do you determine if a patient is a good candidate for OMM versus some other kind of?
Generally, I have to meet them.
Yeah.
But OMM can be applied to just about everybody, because what it does, it helps optimize your health. We help move you to a healthier state no matter where you are on the spectrum. We talk about diet, we talk about exercise habits, mindset, as well as work on you hands-on if that's appropriate. It may not always be appropriate, but I generally have to meet the patient and get enough information to determine that.
Do they need a referral from their primary to come see an OMM doctor? Okay.
Yeah, there's just not enough of us.
Right.
So we need that referral.
Okay.
Mm-hmm.
At OMM at North Bay works closely with our Neuroscience Department, especially on back and neck issues. How does that work? Can you tell us what's involved in how you work with the Neuroscience Department on that stuff?
We work from a team-based approach. The neurosurgeons evaluate through their lens of, is this a person a good surgical candidate? Is there something that we can do minimally invasive but still surgical that we can do to give them relief? Pain physicians are also involved, so they also look at the patient from their perspective. You know, could an injection help? Could a certain combination of pain medications help? They'll look at it from their perspective, and so we bring a unique perspective doing what we do with our hands. So we work together as a team, and since we work in the same office, a lot of the time, like this morning, Dr. Pena came up to me and asked me just a quick question on a patient. Do you think, this would be a good thing for you to see? And she thought so, but she wasn't quite sure, so she just came to confirm. So working in the same space is also very helpful.
Collaborative effort.
Exactly.
Okay.
Yep.
We have a question posted by Sarah. Do you know anything about CRPS? I don't know what that is.
Yes, that's a chronic regional pain syndrome. Okay. That's what CRPS stands for. And nobody knows what causes this. It's very bad pain, usually after some kind of trauma. Sometimes it's a surgery or a break. It's a difficult diagnosis to have. It's a very tough pain case, and there's nobody, it's not well known what can give it relief and what fixes it. A lot of the time patients have to live with it, unfortunately.
Is that something they would probably more likely see a rheumatologist or?
I'm not sure if rheumatology does much with CRPS.
Or pain management. That's what I was
think
thinking.
more pain management. Yes.
Yeah.
Pain management could help with that. It would be a multidisciplinary approach to help manage the symptoms with pain, potentially with neurosurgery, because sometimes it might be a nerve entrapment. Exactly, yeah, to diagnose and kind of see what's contributing to the pain.
Okay. How important is exercise when you talk about this, particularly in spine and low back pain and stuff? How important of a role does that play, and does OMM include getting people more active? And
Yes. Exercise, I can't stress this enough, is vital. It is so important to stay moving, doing what you can. A lot of the times patients that see me, they stopped exercising because it hurts. Well, you still have to move and do what you can. So exercise doesn't always mean go to the gym and lift weights and do something for an hour. It could be something as simple as stretching for 10 minutes a day in the morning and in the evening, and just doing what you can. Our bodies are made to move. Movement helps things. It helps fluid flow, it helps flexibility, it helps with so much. And there's more and more studies coming out nowadays that show that movement and exercise really help your health in lots of different systems, not just neuromusculoskeletal. It helps cardiovascular, it helps brain health, it helps everything. So it's vitally important, and OMM is a big part of that as well, because if you're hurting and you can't move, I can help ease some of the pain with the hands-on techniques so that you can exercise and move a little bit more.
And hello, Marissa, back to you. There are some questions that were posted to us before our chat. Mm-hmm. How does OMM help with neck and hips?
It can help a lot.
those are joints, so you're...
Right, yeah. I would evaluate, again, the whole body, but focus on the areas of pain. Usually I find some restrictions and some tightness in the areas of pain. If there's a need for any x-rays, MRIs, anything like that, I'd be able to determine from a physical exam if that's needed. A lot of the time patients come in with imaging already done, and I'll take a look at that as well. But OMM, working on those areas that are restricted, not moving well with very specific techniques, can definitely help with the pain. And then a prescription for certain exercises and stretches can work with treatment to optimize movement and hopefully lessen the pain.
Okay. And can you explain, well, let's start with, what is FDM?
Fascial distortion model.
Okay, and what does that involve? And can you explain, is it also connected to fascia release?
Yes.
Okay.
It's a newer model providing a foundation to look at the fascia differently. Fascia, if you don't know, is a connective tissue in the body, and actually it was just recently reclassified as an organ all on its own. Wow, bigger than the skin even.
Oh.
So it's an organ. We knew it was there. We've known it's been there for a very long time, but it was just recently reclassified because we're learning so much more about it. It's kind of part of the body that we knew was there, but weren't really interested in it before, but now more and more has been coming out on it. And you would probably know it if you're a hunter as that silver skin, or that thin, clear stuff that's on raw chicken breast. That's not quite the fatty, the fat or the meat. It's that clear, what the heck is this?
Yeah.
Yes, that's fascia. In the fascial distortion model, it provides a framework of looking at how that's tangled or twisted and be contributing to pain. And there are very specific techniques that I use in that model that help to relieve the tangles and the knots that can help give pain relief after a period of soreness.
Okay.
Yeah.
And can you discuss how hip and pain and hip displacement during pregnancy can be helped? Because we had somebody talk about how you helped her with her hip problems.
Hi. Yes. I love treating pregnant women. They are one of the most fun populations to treat because they can't take much for their pain. A lot of other people won't touch them because they're a sensitive population. You don't want to do anything that could be harmful to mom or baby.
Right.
OMM is very, very safe. There's no reports of having been hurt by an osteopathic physician during pregnancy. It's very safe. And because the body releases relaxin during pregnancy, the joints and the ligaments and things are much more lax. So that can get stuck out of place. It's easily, movable. So,
and that's because everything's relaxing, because at some point the baby's got to
come
travel
out
through.
Exactly.
Yeah.
The body's preparing for labor, right? And also just the shift in the weight and your center of gravity moves because of baby growing. So osteopathic manipulative medicine helps optimize the body's function. It takes away any tightness and restrictions so that there's movement but not too much movement, and it can help rebalance things throughout pregnancy so that you have a easier labor and delivery, and then hopefully recovery.
And you talked about during your residency that you went into hospitals. So are some babies able to be helped by OMM?
Absolutely. I do see a lot of babies as well, especially moms that have seen me for treatment. They'll bring a baby in for their postpartum, and then I'll briefly take a look at the baby and kind of see and assess how their head feels, how their sacrum feels, because their bodies go through a lot during labor and delivery as well. I mean, coming through a birth canal, and sometimes babies come out with cone heads. Maybe they were stuck in the canal for a bit, and they need a little encouragement to spring back to that nice round head.
Right.
And that can affect the nerves at the base of their skull, because they're little heads, and there's not much space for the nerves to come through. So getting the head squeezed can irritate the nerves where they come out and come through the bottom of the skull. And that can affect suckling and feeding, because those nerves innervate the tongue, the jaw, the neck. So babies that tend to turn to one side and stay there, that's torticollis, they can have tightness in the base of the skull that irritate those nerves. So loosening that up, helping to balance those tissues out, can help relieve that pressure, and then they can be neutral again or turn to the other side. Same with the tongue muscles and the suckle reflex and the swallow reflex. So that we can help with breastfeeding.
Okay, somebody's asking, why do so many DOs practice more like physicians? Drugs, well, I don't know if that's true.
I think I understand what the question is. Why do DOs that have been taught this wonderful tool not use it and practice like MDs? I'm not sure. I wish more DOs did. I think a lot of it is training, because a lot of DOs go into MD residencies and they don't emphasize the hands-on. Some DOs don't have the confidence in their skills. Some DOs aren't interested, or they've tried and they don't feel like they do well with their hands. I wouldn't say that DOs completely practice like MDs, because DOs, we are also trained in a certain philosophy and a whole body approach. So osteopathic manipulative medicine also is encompassed by a certain philosophy. And there's 4 basic tenets of osteopathic medicine: that the body, functions.
Let's talk about what are those 4 tenets.
Yeah, the 4 tenets are the body is a unit. Like the person is.
She liked your answer.
Yeah, it's body, mind, spirit, and I want to also include community, because a person's socioeconomic status, their access to certain things, certain parts of healthcare is also important in their health. Structure and function are interrelated. That's another one. Let's see. Structure and function.
Oh, I'm putting you through your test again.
Pressure.
Sorry, you're getting your medical. She says holistically.
Yes. And then the last one is there's a 4th tenet. I know the last one. I forget the 3rd one. Oh, they would be so ashamed of me. It's the pressure.
Being on the spot.
Right.
Being
on the spot, being live.
It's okay. You've already got your medical degree.
Right. And we base treatment logically on things. Like, I'm not going to go, do an MRI if it's not needed. I'm not going to send you for surgery if it's not needed. I'm going to provide treatment that's appropriate. I'm not going to hit a fly with a hammer.
And would you say it's also true that you're not the type of doctor who's going to ignore what the patient has to say?
Right.
The key part of figuring out what you're going to do has to do with what they're saying and listening and hearing.
Yes,
and
I would absolutely say that.
Okay. So let's talk again about some of the things that OMM can help with. So we've talked about neck and lower back pain. I would assume you see a lot of that in your practice here.
That's most of what I see. Yes.
And babies, but what about young children and teenagers and athletes? Do you see a lot of stuff that comes out of, I wrenched my neck while playing whatever? And okay.
I do. I see young athletes. I've seen teenagers with scoliosis. I've seen young patients that have there's one patient that I see that has a sensory processing disorder. He's on the autism spectrum. I see a lot of those patients because, again, we address the whole person. We address, what are you eating that could be contributing to symptoms or making symptoms worse? Are you using cognitive techniques that occupational therapy may have given you? How can we modify those to fit a little bit better with your specific situation? So there's lots of different things that we can work with.
Right, and I know it's very hands-on, once you figured out that hands-on is what they need.
Right.
How is the hands-on that you do different from what a physical therapist would do?
There is some overlap. They have specific techniques, they have specific training, but I have the freedom to do what I feel needs to be done. The physical therapist is kind of restrained by what the physician's prescription is written to. If a patient goes to physical therapy and the doctor sent them for shoulder pain, they can only work on the shoulder. They can't exactly look other places and say, oh, well, your hip is affecting your shoulder, so therefore I need to do XYZ before I even get to the shoulder. That's a little harder for them to do, and unfortunately the way that our system is set up, that's what they're restricted to do.
Right.
I have the freedom to be able to do what needs to be done and kind of look at everything, and I have other techniques that physical therapists may not know of.
So when somebody walks in your office, can you kind of tell right away they're having a problem with their back or their head based on
Most of the
how
time.
they're walking and what they're...
Based on their posture, based on how they're walking, yeah.
Yeah. And then you'll sit down. What's a typical first appointment with you like? You're going to...
First appointment is 45 minutes long.
Oh, wow.
Most of it is spent kind of getting to know the person and talking about what their pain is like from day to day, what irritates it, what helps it, everything that they've tried. It's a long talk.
Okay.
Trauma history. We'll go over other people's diagnoses, if they've had any imaging, and kind of where they're at, what their mindset is, what they expect, what they're willing to do. Some patients come in and they're very highly motivated. They want to do everything. Other patients, unfortunately, may be reluctant. There might be a block. They might be under a lot of stress and they don't have a lot of time for themselves. So it's more situational or social that they can't get the time to care for themselves the way that they need to. So most of the 45 minutes is spent kind of assessing those things before I even get to an exam. Then I'll get to an exam, do a once over, look at everything from head to toe, see where the most pressing issues are, and then I'll give them a little bit of treatment just to see how the body would react, because some people are very sore after treatment and their body kind of goes a little bonkers. So I'm very cautious when I first meet somebody just to kind of see how they'll respond to treatment. Most people respond well. Most people, they might be sore for a day or two, maybe 3. They might have some bruising, but then they're fine and they're feeling a little bit better, but then the pain will come back. So depending on how chronic it is, there's follow-up.
Right.
Yeah.
I forgot to ask you, one of the other questions that came in earlier was one of your patients who said he had lower back pain and you recommended that he get involved in yoga, and it made all the difference in the world. Why is yoga a particular kind of exercise that might help with these kind of problems?
Yoga is fantastic. And
do you do yoga, by the way?
I have. I need to get back into it a little bit more, but I do.
But you're pretty.
Yes.
You're a strong advocate, and you exercise.
Absolutely.
At HealthSpring, yeah.
I try to lead by example, and I just got my blood work done, and I've got normal blood work, and I exercise like 3 times a week, and I try to keep strong so that I'm healthy for my patients.
So you're practicing what you preach.
I do. But yoga is a wonderful type of exercise because you can do yoga if you can follow a video. Yoga is for any level, whether you're an advanced athlete, an elite athlete, or if you can't even walk. There's chair yoga. So yoga is as difficult or as easy as you want it to be. There's options for everybody. And there's so many studies out there now that show the benefits of yoga. It helps with flexibility. It helps with core strength. Depending on how quickly you change poses, it can help with cardio. There's a lot of benefits to yoga, and it gets the body moving in ways that you wouldn't normally move with other activities.
Okay. So if somebody's coming to see an OMM doctor such as yourself, what piece of advice would you give them in terms of what to ask or what to bring with them, or how to be prepared for that first session?
Oh, be prepared for a longer appointment at first. Try to remember all your traumas, because sometimes I'll get talking to patients and they'll forget, oh yeah, I was in a major car wreck when I was 16. That can still matter.
Okay.
Even small fender benders sometimes can cause some issues. It's not just the major traumas that are important, it's kind of smaller accumulative traumas as well. Bring everything. Bring your whole medical history, because we'll want to know.
Right.
Yeah.
And then you don't have to repeat tests.
Exactly.
And that sort of thing.
Right.
Okay, well, I think we've reached the end of our time. I want to thank you and for taking time out of your schedule to do this.
Yeah.
And you can read even more about Dr. Lim on her profile at northbay.org, where it also has phone numbers and addresses and how to contact her and get an appointment and so forth. So thank you very much for being here, and thank you all for tuning in.